This program is made possible by the support of Delta Dental, Quick Trip, Marshfield Clinic Health System, Wisconsin Counties Association, Wisconsin Hospital Association. Watch Wisconsin Eye on Spectrum Channels 995 and 363 and at wisi.org.
A reminder to maintain audio quality, please keep your phones on mute until it's time to ask your question. If you're able to do so, please use *6 to mute and unmute your phone. Joining us for today's media briefing are Governor Tony Evers, DHS Secretary-designee Andrea, and available to answer questions are Dr. Ryan Westergaard, the Chief Medical Officer for the DHS Bureau of Communicable Diseases, and Ryan Nilsestuen, Chief Legal Counsel in the Office of the Governor. We will begin today's briefing with remarks from Governor Tony Evers.
Good afternoon, and thanks for joining us again today. Since we spoke last Thursday, more than 9,000 Wisconsinites have tested positive for COVID-19. And since I sat here a week ago Tuesday, we have lost 98 of our family members, friends, and neighbors. We also learned that the President, First Lady Melania Trump, and many of their close contacts have also tested positive for the virus. Kathy and I send our wishes for a speedy, full recovery to all of them, our fellow Wisconsinites, and the hundreds of thousands more nationwide who are fighting this virus. This serves as a good reminder to all of us. This virus can affect anyone, whether you're President of the United States, a worker, a student, a service industry worker, small business owner, retiree, or an elected official. We need everyone together to take precautions to keep our neighbors and communities safe. It is simply not enough to only wear a mask. We need folks to take further action to help stop the spread of this virus and flatten the curve. Because here's the deal, folks. Our hospital systems are not invulnerable either. Our healthcare systems are teetering. They're on the brink, and when there's no room at the inn, and that inn is your local hospital, that's a problem for everyone. Just this last weekend, more than 200 doctors in Brown County called on elected officials and individuals to do their part and help spread this virus, stating, quote, "To say that providing care to these patients is severely straining our local hospitals, healthcare workers, and health systems is a drastic understatement. There's no other way to say it. We are overwhelmed." Right now, the best way you can help support our frontline healthcare workers and providers is to stay home as much as possible. This not only helps stop the spread of the virus, reducing the number of hospitalizations, but it also protects our frontline healthcare workers, keeping them healthy and safe, so that they can continue to take care of our most vulnerable patients. So I want to thank the 200 healthcare providers I mentioned, as well as the public health leaders, especially those in the Fox Valley who have issued a public health emergency COVID-19 alert. Thank you for your efforts to protect our communities. We are encouraging public health leaders across the state to take those extra steps to keep Wisconsin communities safe during this dangerous time in the pandemic. But they can't do it alone, Wisconsin. We need everyone to think about their family members, friends, and neighbors, and to look around and see what carelessness and apathy can do. To see how one case can turn into 12 in the blink of an eye, how one dinner party or one wedding can lead to weeks of recovery, and how our economy, our communities, and our states go backward every time one person or group disregards public health measures. That's why today I directed Secretary-designee Palm to issue a limit on public gatherings in Wisconsin. With exceptions such as schools, child care centers, and healthcare and long-term care facilities, to name a few, indoor public gatherings are limited to no more than 25% of total occupancy limits for the room or the building. Trust me, folks, I know we are all tired. We are all frustrated, and we just want to get back to our Wisconsin way of life. You and me both. But at the end of the day, whether we like it or not, we have to change the course of this virus, and that's going to take a united effort. We need to do this not just for our healthcare providers, but also for Wisconsin small businesses. The sooner we get this virus under control, the sooner we can get back to the activities we all enjoy. But we also have to make sure that our favorite small businesses, venues, and destinations are able to keep their doors open until we get there. That's why today we're also announcing that we are investing another $100 million in businesses and communities across our state. Our communities are in desperate need of additional federal support, but we can't wait a moment longer. Our investment includes over $50 million for WEDC's We're All In grants to help support more than 10,000 Wisconsin small businesses, $20 million for the Wisconsin lodging industry, $15 million for live music and performance venues, as well as additional support for movie theaters, nonprofit cultural venues, and the tourism industry. Wisconsin small businesses have been unbelievably creative, adapting to the challenges of the pandemic, but they are stretched to the limit. These funds will provide critical support, but in the meantime, we need everyone to change their behaviors and work together so that we can get back to some sort of normal for our kids, for our small business owners, for our workers, and of course, for each other. Stay home as much as you are able. Limit your travel to the essentials like work, school, and picking up groceries and prescriptions. Avoid any family gatherings, dinner parties with neighbors, weddings, and other events with folks outside your immediate household. This is one of those rare occasions where staying away is actually the best way to show just how much you care about your loved ones and your friends. You have to leave your house, whether it's to go to work, pick up the groceries, or get some fresh air. Wear a mask and keep your distance from anyone who is not a member of your immediate household. Wearing a mask, believe it or not, is not a political statement. The sign of basic decency and kindness for those around you. If you start to feel sick or unwell, get tested and isolate yourself from others until you get your test results. And last but not least, wash your hands frequently and disinfect commonly touched shared surfaces often. I have faith in the power of Wisconsinites when we band together. And I know that if we focus on working together to flatten the curve and look out for the health and safety of our neighbors, we can get Wisconsin back on track to overcome this virus and bounce back stronger. And now I'll turn it over to DHS Secretary-designee Andrea Palm. Andrea?
Thank you, Governor. And thanks to everyone again for joining us today. I do want to start with the numbers today because, as Governor Evers just said, we are at a critical moment here in Wisconsin. There are now 136,379 confirmed cases of COVID-19 in Wisconsin, which is an increase of 2,020 cases over yesterday. Our 7-day average of new daily cases is 2,346, up from 836 1 month ago. We're seeing increased COVID-19 hospitalizations across the state, and every region is reporting current and imminent hospital staffing shortages in one or more of their facilities. Our total deaths have now reached 1,399 of our fellow Wisconsinites. We are in a crisis, and to get out of this crisis, we need to take action. Back in March, we all stayed safer at home to flatten the curve and protect our frontline healthcare workers, the healthcare system, and our public health infrastructure. Today, we are in a worse place than we were in March, and so we need to think like that again. Please stay home when possible and wear a mask when you go out. The unfortunate reality is this. The disease activity level of COVID-19 in Wisconsin is so high that going to a gathering puts you at very high risk of exposure. That is why, at the direction of the governor, I signed an order to limit indoor public gatherings today. We know gatherings are a key way this virus spreads, so we must act to limit indoor gatherings to stop the spread, reduce illness, and save lives. We've seen local and tribal health departments across our state release public health alerts to draw further attention to this crisis here in Wisconsin, and we encourage local leaders to respond by putting additional mitigation orders in place in your communities. And we'll need your help too. Every one of us can model safe practices within our own family, with our friends, and within our communities. Stay home, wear a mask, keep 6 feet apart, wash your hands, get your flu shot to help preserve our hospital capacity, get tested if you have symptoms or have been exposed to COVID-19, and answer the call from a contact tracer. This is a critical moment in the pandemic for us, and we each need to do our part to help stop the spread. Thank you.
Thank you. And we will now take your questions. A reminder to maintain audio quality, keep phones on mute until it's time to ask your question. We have a hard time out today, so please, we're going to stick with one question per reporter per outlet. And we will begin with Danny Maxwell from WKOW in Madison. Danny?
Hi, this is Emily from WKOW. Thanks for doing this call. I have a question for DHS. Some county public health departments we've spoken to say they are at capacity for the number of contact tracers, telling people that you might not get a call from them, that you've become in contact with someone who tested positive. So how concerning is this? And are we at the point where we might not have enough contact tracers to keep up with the demand and the rising number of COVID cases?
Thanks, Emily. I think it's really important, right, as we talk about the strain on our frontline healthcare workers and our healthcare system, that we also don't forget about the strain on our public health infrastructure, and that includes our contact tracers. We absolutely, as these cases have risen rapidly in the last couple of weeks, have seen the inability of local contact tracers in a number of jurisdictions to keep up with the influx of cases. It is why, when we built out this system and worked to reach our goal of 1,000 contact tracers, which we have now exceeded, we at the state reserved or worked with the locals to decide that we would provide surge capacity for local jurisdictions in cases where they were having trouble keeping up. But I will tell you that our surge capacity at the state among our employees is also at capacity. We have 100 new contact tracers starting on Monday, and we will continue to hire at least to a marker of 400. Which is double where we had been in recent months at the state, so that we can continue to try to help local public health keep up with this particular task. I think it is also why, and Dr. Westergaard may want to say more about this, why there is a guidance from DHS that institutes a similar sort of crisis standards of care model to help give information to local public health about ways to reduce the burden of contact tracing, a shortened questionnaire form, encouraging those who test positive or their contacts to help be the person who contacts other folks to encourage them to isolate and quarantine. So there are some strategies that people can employ to help reduce the burden, but we absolutely need more contact tracers in the system to continue to do this work. We will continue to hire more and do our best to be good partners to local public health as they struggle under the weight of rising cases. But more broadly, right, it speaks to the need for us to do more. People need to wear their masks, but it's not enough. It's an important strategy, but it speaks to the need for the order that I signed today. We have to reduce our social contact with other Wisconsinites. We need to do everything we can to stop the spread of this disease, take the pressure off our contact tracers and public health system more broadly, as well as our frontline healthcare providers and our hospital systems.
All right, the next question goes to Molly Beck at the Milwaukee Journal-Sentinel. Molly?
Hi. Does this mean that you're seeing a lot of the outbreaks or the spread of the virus coming from indoor gatherings at bars and restaurants and places that you're limiting now?
Mm-hmm. Yeah, I think, right, the spread of this disease currently is intense and it is community-wide. We absolutely see transmission among indoor gatherings, and we have throughout. Right, this virus is very opportunistic, and it will find ways to spread if we give it that opportunity. And I think when you're talking about something like a bar or a restaurant where you need to remove your mask to partake in the activity that you went to that location to do, you increase the risk for the people around you in that establishment. And so there are absolutely places where we are seeing spread, and we need to make the choice to reduce our time outside of the house in these large or larger public gatherings that increase our risk for spread.
All right. Thank you, Molly. The next question is for Joshua Piguero, BAY in Green Bay. Joshua?
Hi, how are you doing? This is Joshua Piguero with WBAY. Thank you so much for taking my call. Question. What I wanted to know, do you know of any counties that have violated or have gotten in trouble for not enforcing the mask order? And part of that is also in Brown County specific. Do you know of any? Have you received any complaints from businesses in Brown County or people in Brown County about the mask orders not being enforced?
Yeah, we hear from folks and counties all the time. That's certainly part of the problem. We know that masks work. We also know that there is a number of people that believe that wearing a mask is not important. It is important, and so yes, we do hear those complaints, just like people do hear those complaints locally. And it's our goal to continue to reach out to folks that don't believe it and encourage them to wear a mask.
Nilsestuen, I'd just add to the mask order applies to individuals, and local health officials and others play a very important role in enforcing it. It really is, due to the numbers that we're seeing, as the governor said, it really is upon all of us to do the right thing, to stand up. Because it's simply not possible to have public health officers and officials do all that we're asking them to do and also run around trying to issue tickets and other things. And so in combination with people standing up doing the right thing, today's order on mass gathering bans, we hope that will put everybody in a better place in terms of giving capacity and ability for local public health officials to focus on their work.
Thank you. And the next question goes to Heather Poltruck, WSAW in Wausau. Heather? And a reminder, press star 6 to mute and unmute your phone. We'll try Heather at WSAW. All right, let's move on to Todd Richmond at the Associated Press. Todd.
Hi there, this is Amy Forlity standing in for Todd today. Thank you for taking our question. I just want a clarification. Is it up to the individual counties to limit the mass gathering numbers? And also I'm wondering how this will, why you think this will get past the conservative Supreme Court? And those questions are for Governor Evers. Thanks.
I think I can answer that for the governor. So two things. In terms of how the 25% is determined, it's such, every business or other location for the most part has local capacities that are set by local officials, by fire inspectors. You see that when you walk into a restaurant and it has the sign saying it's limited to 250. And so that's the number, that's how it's determined. These are numbers, capacity limits are already determined across the state. That's why we went with using capacity limits, because people understand them. They're already in place. We're not reinventing the wheel. In terms of your second part of your question with this order in the conservative Supreme Court, it's always something that we have to keep in mind. When going about this, we saw with Safer at Home, despite following the clear language of the statute and despite the science and the facts being behind us, that we received a very political decision at behest of the Wisconsin legislative Republicans filing that lawsuit, and I have no doubt that we'll probably see litigation on this order as well. That said, this is a very targeted order. It's using authority from DHS authority that the Supreme Court did not touch in the Safer at Home decision. In fact, they exempted the one part of the Safer at Home order that was not overruled by the Supreme Court, relied on the exact same provision, and it allows DHS to limit and regulate public gatherings at schools, churches, and other places, and that's exactly what this order does.
All right, and the next question goes to Rob Sussman from WTAQ in Green Bay. Rob?
Yes, thanks for taking my question. It is for Governor Evers. Governor, by state law, says that you are allowed to declare one emergency order for a 60-day period per emergency. And in fact, this is the core of WILL's lawsuit against the state. My question for you is, how many orders do you believe you are entitled to make during this pandemic? Thank you.
Well, I'd sure like the pandemic to go away. We wouldn't have to worry about that question or that answer. The order that we did in August and the one we did a few days ago, a public health emergency, were dependent specifically on specific numbers, specific changes in the outlook every time. And, certainly UW campuses was an issue. This time it's just a massive number of hospitals and hospital systems that are teetering. We have to make sure that all those things are taken care of. So the virus is not, it doesn't follow our rules. It changes and it impacts us in different ways. And so hopefully this present order that we issued will drive the numbers down. We don't have to worry about another health emergency.
Thank you for that. And we will go now to Sean Kirkby at the Wisconsin Health News. Sean, what is your question?
Hi, thank you for holding this. I was wondering, I know earlier this year, the alternative care facility at the Alliant Energy Center was put on hold, or at least plans for it were put on hold. Are you reassessing that, and are you planning to move forward on developing that as a surge facility? Thank you.
Sean, you're asking about Alliant, right? In Dane County. Did I hear that right?
Correct, yeah.
So we obviously are in close touch with our hospital systems around the state as we see the rising cases and assess on a daily basis sort of where we are and if and when we might need to stand up the alternate care facility in the Milwaukee area. We absolutely are open and happy to have conversations here in Dane County should the cases here get to a place where they might need backup. But at this point, that's not where we are. But again, we want to make sure we use every tool that we can to protect the people of this state, and so we'll have those conversations as necessary and do what we need to do to make sure that our hospitals have the backup that they need to serve and treat the people who need care in their hospitals.
Thank you. And the next question, Victor Jacobo, CBS 58 in Milwaukee. Victor.
Hello, good afternoon, and thank you again for taking this call. Considering the surge as we head into the winter and with obviously the limiting of businesses, if some businesses have to close again, what changes have been or will be made at the Department of Workforce Development to prevent another backlog of unemployment claims? Thank you.
We are, in the last couple of weeks, we have made significant changes within the processes of issuing money to claimants under unemployment insurance, and we feel confident that we will be able to take care of that backlog going forward. Unfortunately, we're actually seeing people run out of UI eligibility because the money because the limits have run out, and so we will continue to have those backlogs be made. I think we're going to be able to be in a good shape in the very near future. That will give us a chance to take a breath and move forward in case there is another surge.
All right, and the next question to Lane Kimball at News 3 in Madison. Lane.
Thank you, everybody, for taking this call. Packers improved to 4-0 last night. Everybody's happy about the Green Bay Packers. Has the state had conversations with the Packer organization, with Lambeau Field? I know that the team is hoping to eventually have some fans, if not full capacity, obviously, in November and for December games. And then also, is seeing folks like Matt LaFleur and Aaron Rodgers encouraging people to wear masks, is that a benefit? Can that help the state spread that message to everybody in Wisconsin?
Well, certainly the Packers can be good spokespeople for wearing masks, and they have done that in the past publicly, and hopefully they'll continue to do that. We have ongoing conversations with the Packer organization, and we'll be working together to make sure that people, if there are any people in the stands, that they're safe. That's critically important.
All right, and the next question will go to John Nicer, NBC 26. Jonathan?
Yes, I see on the executive or emergency order number 3 FAQ how this order is enforced, civil forfeiture under section 252.25. Could somebody explain what kind of penalties an establishment might face and who will do the enforcing?
Sure. This is Ryan Nilsestuen. I can answer that question. Like the other state health orders, we're first and foremost asking people to do the right thing, to avoid large gatherings. If they're hosting an event, to avoid doing so. That's the best thing that people can do in order to slow the spread of COVID. We're also encouraging local authorities who can enforce the order to try and educate the public first. That said, where there are situations where those efforts aren't enough, local officials can issue a civil forfeiture under the section that you cited, and it can be up to $500. But again, we're hoping that people do the right thing and avoid mass gatherings.
Thank you. And the next question will come from Taj Mahal at WMTV in Madison. Tajma.
Thanks for taking my question. So Secretary Palm mentioned that we are right now in a worse place than we were back in March. So is there any concern of having to possibly try to shut things down again as we did with the Safer at Home order? Or do we think that the mask mandate coupled with this new order that you're announcing today will be enough to reduce the spread?
Well, it's our hope. Believe me, Safer at Home did work. It helped create a situation where people were staying safer at home and not spreading the disease. And so we had good results from that. Clearly, the Supreme Court and their allies in the legislature made sure that didn't go any further. So we are counting on this, the mask order, the present mask order, and the present order that we released today about public gatherings to make a dent. But at the end of the day, it is around individual responsibility, and we're hoping the people of Wisconsin will take it up. I know the majority of people of Wisconsin have. We're encouraging others that may have had questions about wearing a mask and the impact of that and not doing that is severe. And so we're very hopeful that the steps we're taking today will begin this, to get us to a better place.
The only thing I would add is that we made sure in this order that it's a floor, and as I mentioned in my opening remarks, we would encourage local jurisdictions who can and need to do more to build on this order to take those kind of actions as they have the ability and authority to do that.
All right, thank you for that. And we will go to Will Cushman at WisContext for our next question. Will.
Good afternoon. Thank you for taking my question. So I think we've gotten a good understanding of the legal basis for this new order, but I'm wondering, I guess this question is for Dr. Westergaard, if you could remind us about the scientific evidence or the scientific basis for this order limiting indoor public gatherings and what you hope it achieves. Thank you.
Sure. I would say the strongest scientific justification is the observation that the virus travels between people who are in close proximity, and therefore it follows from that density of people in an indoor space, particularly an indoor space that may not have great ventilation, is going to be the environment in which transmission occurs most easily. So worldwide, not just in Wisconsin, we've seen super spreader events that tend to be located in these indoor environments with potentially limited ventilation. So I think it's a key to preventing the spread is to limiting the density or the number of people in an enclosed space. So this naturally follows from that principle of infection control for respiratory viruses.
All right, thank you. And we go now to Eric Gunn with the Wisconsin Examiner. Eric, you have the next question.
Thank you very much for this. The positive test rates are very high over most of the states, although they vary from county to county, and in some places the raw numbers are still relatively low while having the high rates. I'm wondering if you could speak a little bit to the factors that influence those varying positivity rates, and also what, in addition to the measures announced today and previously, the masking order and the mass gatherings limitation, what localities need to be doing to bring those rates down? Thank you.
Do you want to take the first one?
I take the first one, but what sort of determines the positivity rate? It depends on both how widespread the virus is spreading and then how many people get tested. And I think one of the things that determines the latter, how many people get tested, is the testing availability, the ways that in which the health systems and community testing sites are set up to make that easily accessible to people. If it was very easy for everyone to get a test, we would probably see a lot of people having a lower threshold for getting a test with minimum or no symptoms, and the test rate would be lower. When we see a high percentage of tests that are positive, it means that a larger number of people who are getting tested are positive, and it might be a limitation. People who are getting tested positive because they have symptoms or because they're sick or are highly suspicious. So both things make a difference. Both, how many people are truly sick or truly symptomatic, but then also one of the reasons our goal is for have that number low is because it's a signal that that there's a relatively fewer barriers or a lower threshold for people to get tested with minimal or no symptoms, and that we know varies by health system and by county just because of the testing resources.
Eric, the other part of your question, we last week, you have to forgive me, I forgot which day, released a guidance that a number of counties based their recent public health alerts on, and in that guidance, we sort of stepped through a process to help local communities, local jurisdictions determine sort of where they are on the spectrum, and then links that directly to the kind of mitigation strategies that you could employ to help reduce the spread. And so if a local jurisdiction wanted to do things in addition to the mask order and the public gatherings capacity limitations that we did today, they have available to them this guidance that steps its way through that process and the thinking and the context around how to make those kind of decisions, and then links it to the kind of mitigation strategies you could employ if you wanted to. That is available on our website, so you're certainly welcome to look at it there. And we are happy, as always, to work with local public health, on TA or other sorts of conversations that they might want to have as they think about how to employ this guidance to build on the order that we put in place today.
Thank you. The next question now from Mitchell Schmidt, Wisconsin State Journal. Mitch.
Yeah, thank you very much for the call today. I think you just kind of touched a little bit on this, but I was wondering if you might be able to speak to, in regard to the advice you had provided to local public health officials on kind of taking their own COVID-19 precautions. I was just wondering how much kind of feedback, or have you heard of any local officials kind of taking those precautions? Thank you.
Well, as I mentioned, a number of jurisdictions have done public health alerts that provide guidance to their residents, to their citizens, based on the mitigation strategies that are included in the guidance. I think a number of jurisdictions, either in regional collaboration or individually, are having ongoing conversations about the things they might, additional things they might want to do, how to think about them, how to work with their local business communities, their local healthcare systems, and other influencers in their communities to improve compliance and folks understanding and therefore acting to do the right thing as it relates to stopping the spread. But I think those conversations vary across the state, depending on what they're seeing in their local communities and how they are interacting with local public health and their systems more broadly to think about doing the work they need to do to stop the spread.
Thank you for that. And the next question, Jeff Dada, Spectrum News. Jeff, your question.
Hi, thank you for taking the call today. My question is about inmates at state facilities. There are now outbreaks at 2 facilities with hundreds of cases. I guess I'm wondering what steps are being taken to mitigate outbreaks at state correctional facilities, and would you guys consider more aggressive steps if these outbreaks continue? Thank you.
Well, as you know, there have been outbreaks, and frankly, even smaller outbreaks previous to this point in time. Already, we have absolutely made it so that it's difficult for outside forces to bring it in, except for, of course, the employees. But we isolate quickly and get the 14 days in isolation done, and drop those numbers significantly. That's happened every outbreak and every institution that we have where we have people in our care. It's really important for us to make sure that we are right on top of it. I can't remember the exact number, but it's tens of thousands of tests have already been given to people in our care and in our correctional institutions, and will continue to do that. Heavy-duty testing is really important, and immediate isolation drives those numbers down very quickly.
I think it does speak more broadly. The governor mentioned staff, and it's the same, for nursing home workers, for healthcare workers, for corrections workers. Because of the intense community spread we are seeing across this state, those folks are being exposed and infected in their communities. And when you're talking about a hospital population, a nursing home population, a corrections population, those congregate living settings where you can see spread more easily, it is a clarion call for all of us to do the right thing, to be compliant with the mask requirement, to follow this public gatherings restriction, and help get us to a place where our workers are protected so that they can go to their jobs and not have to stay out in isolation or quarantine because they've been exposed in the community. We need the workforce across the board to be healthy and well, to keep our corrections institutions operating, to keep our hospitals operating, to keep our nursing homes operating.
Thank you. The next question from Christina Nickel at WLUK in Green Bay. Christina.
Hi there. Thanks for taking the call. So I guess what we're kind of wondering over here is, with this increase in numbers, especially here in Northeast Wisconsin, how are you expecting people to enforce the rules if we're already seeing such significant outbreaks?
I think I talk about the enforcement part, and as you mentioned in your question, with the significant number of outbreaks, especially in northeastern Wisconsin, it's very imperative that people do the right thing, that they do limit mass public gatherings because of all the issues that Secretary Palm highlighted, especially in terms of the impact it has on our workforce, not just in prisons, but also in our healthcare sector. There's a reason why 200 doctors in Brown County called out for action, is because of what we're seeing on the ground there. And in terms of enforcement, first and foremost, we hope people do the right thing. But second, there is a civil forfeiture provision, and that can be enforced by local officials for people who refuse to comply. But again, we hope people do the right thing and avoid large gatherings in order to stop the spread of COVID.
Thank you. The next question to Mason Dowling, WAOW in Wausau. Mason.
Hi, thanks for taking this call. Governor, already you've obviously had some pushback from prior emergency orders. We've mentioned WILL's lawsuit already, and I would personally be surprised if there wasn't some kind of pushback from this within the day. Are you expecting WILL or other groups or even legislatures in the state to say that this is going too far, or that, like previous orders, Andrea Palm's authority is overstepping, she's overstepping her bounds?
Well, it's always hard to predict political behavior, but if it's consistent with the past, then I guess we would expect to have a challenge in the court. We believe we can overcome that challenge, just like we believe we can overcome the challenges that exist on the present mask order. That said, at the end of the day, doing orders and having them challenged in court maybe makes for great theater. Frankly, does nothing to make sure that people are safer here in the state of Wisconsin. We need to have as much cooperation as possible in the state from the people of Wisconsin. We do have limiting rules for all sorts of other things. There's limiting rules about how many deer you can harvest every deer season. There's limits on how fast people should be able to drive. You can't drive on the left-hand side of the road. There's all sorts of things that and we don't permit smoking inside bars and restaurants. But at the end of the day, this is not about Wills versus Evers or Republicans versus Democrats or whatever. It is about individual responsibility. We're providing leadership with this order to make sure that we are in a place that we're going to make a difference. To me, it's always been less about who sues who and what is the outcome. We spend a lot of time talking about it, but it doesn't keep a single person alive, doesn't keep a single person from getting it. What keeps people from getting the disease and dying from the disease is individual responsibility. We have expectations in other areas. This is just one more, and it's one that will be temporary if we get people to understand how important it is to do the simple things like wearing a mask, washing your hands, making sure that you're not in a small room with a bunch of people without a mask. It's not rocket science. It's around individual responsibility.
Thank you for that. Next question to Madeline Anderson, Fox 6 in Milwaukee. Madeline. And a reminder, *6 to mute and unmute your phone. The next question to Madeline Anderson at Fox 6. All right, let's move on to Terry Sater at WISN in Milwaukee. Terry, are you with us?
Good afternoon. My question is for the governor. Yesterday, during the hearing on the Will lawsuit, St. Croix County Circuit Judge Michael Waterman said the legislature can extend or terminate the governor's declaration of a state of emergency at any time and apparently for any reason. Governor, what is your reaction to the fact that the legislature has not met for more than 170 days? And then Senate Majority Leader Scott Fitzgerald said the governor hasn't proposed any new legislation for us to act on in regard to the pandemic.
Yeah, well, we've provided lots of leadership as it relates to other orders that we've had, and we believe that the state does have to lead on this. So the legislature can come into session anytime they want to, and if they did, that'd be great. We could hear what their plan is when the Safer at Home order was ended by the Supreme Court. The argument that the Republicans made was that they had a plan. Haven't seen it. Hopefully it will arrive soon, but in the meantime, we are going to continue to insist that we have to lead. We just can't wait.
All right, and the next question to Royce Podeswa at WisPolitics. Royce. Royce at WisPolitics. All right, why don't we try McKenna Alexander at WQOW in Eau Claire. McKenna Alexander. And a reminder, *6 mutes and unmutes your phone. McKenna. Angelina Salazar at WUWM in Milwaukee. Angelina.
Oh, good afternoon. Secretary Palm, you mentioned that we are currently worse off than we were back in March. And I'm curious to know, do you say that because of the state's surging positivity rate? And if so, why is that positivity rate so concerning? Is it because there are more people dying in Wisconsin than any other state? Which we both know isn't true, but please break it down, for the people who aren't following this day by day.
Mm-hmm. Yeah, so I think it's a great question, right? In March and April, when we had Safer at Home in place, that's what we were doing together, right? We were staying safer at home. We were limiting the spread by the very fact that we weren't gathering or coming into contact with folks outside of our home. We were vigilant about sticking to our essential errands, once a week, groceries, the pharmacy, the things that you needed to do. But otherwise, we really were in it together as it relates to stopping the spread, flattening the curve, and giving us the space and the time at the state and with our partners in healthcare, public health, and the hospital systems to plan for the future. In recognition that we weren't going to have a vaccine in the near term, and that we needed to do some work to get ready to keep doing battle with this virus, right? And so that meant building a contact tracing system, building a statewide testing system, planning and setting up that alternate care facility, which is our ultimate insurance policy. It was allowing hospitals and individually and among their regions to do surge planning and think about how they would handle cases should the hospital systems come under strain. And when Safer at Home was lifted in May, we have seen an increase in cases since that time. We had a small surge in July that was more localized, and those jurisdictions put in place mitigation strategies. They reduced capacity in bars and restaurants. They did masking orders before the statewide order, and those strategies made a difference. They helped reduce the increase in cases that they were seeing. And then in September, obviously, we started to see the surge that we are in now, and that was around the 18 to 24-year-olds returning to campus. We were seeing it in that age group, and most severely in local communities where those campuses are. And subsequent to that, right, we have gone beyond the 18 to 24-year-olds, and we are seeing intense community spread in all age groups in communities all across this state. And so it is, in comparison to March, not only have we seen a rise in cases broadly, but we have seen a rise in cases to the point that the systems that we took the time to build over the summer, that public health infrastructure, the surge planning for hospitals, the statewide testing capacity, we've gotten to a place where we're having trouble keeping up with the rapid rise in cases that we're seeing in this state. It is impacting our workforce in nursing homes, in hospitals. We talked about corrections facilities. If you don't have enough doctors and nurses who are healthy and well to show up to work, it doesn't matter whether you have COVID or a heart attack, you need that healthcare provider to provide that care to you. And so we are seeing a strain in those systems that is not sustainable, and that unless we break this transmission, unless we change our trajectory and get back on track and see our cases start to go down, we will overwhelm those systems. And that is what we talked about in March. That is the absolute place we don't want to be. And we've done all of these things to try to prevent getting there. And we are now closer to that scenario than we ever have been. And it is time for us, through this public gatherings limitation, through the mask order, through additional measures that local communities can take on top of that, now is the time for us to come together and to get back on the right track and reduce the spread of this disease.
Thank you for that. The next question, Rachel Vasquez, Wisconsin Public Radio. Rachel.
Hi, I was wondering if someone can talk about what kinds of food businesses are exempt from this order, specifically if grocery stores are exempt.
Yes.
All right. Thank you for that. Next question, Lauren Linder, TMJ4 in Milwaukee. Lauren.
Hi, can you hear me?
Yes.
Okay, thank you for taking my call. Mine was directed specifically for Dr. Westergaard. You obviously know that the president was, as a part of his treatment, was just given remdesivir, and also know that it's been given to patients here in Wisconsin. What do you think about its effectiveness of those who have been given the treatment here in the state, and do you feel that it should be more available than it is currently?
Sure. You were a little hard to understand, but I think it was comments about the effectiveness of the treatments that we heard were used by the president. So there are three, in general terms, there are three types of treatment that have enough evidence to support use in the general public, meaning they've received emergency use authorization by the FDA. And one of them I heard you mention is remdesivir. That's an antiviral drug. Another one is dexamethasone, which is a corticosteroid, which has been around for a very long time to reduce severe inflammation. And the third is convalescent plasma. So the news reports were that the president had received two of those, both remdesivir, the antiviral drug, and dexamethasone, the anti-inflammatory drug. There was reports that he received a third treatment that is not FDA authorized, which is not available for use, and that's a cocktail of monoclonal antibodies. Those are intended to work in the same way that plasma does, so they're antibodies directed against the virus. But rather than using plasma, where they have millions and millions of antibodies from a person who has recovered from COVID-19, they're engineered to be just the specific antibodies that target the protein on the virus. So that treatment is not approved. It's not available for the general use. It hasn't received authorization, which means that not enough data has been generated to show that it's convincingly safe and effective on a large scale. So it's not currently available.
Thank you.
Dr. West.
All right, let's go now to Heather Poltrock, WSAW. Heather. Heather from
Thank you.
Oh,
Thank you for coming back to me. A lot of school districts have launched these online COVID trackers for parents to take a peek at. And I'm wondering, does that data come from the state, or does the state see that data and monitor it and just kind of keep tabs of it?
It's not something the state does, and so I'm assuming it's something the school districts have decided to use on their own. School districts, at least from my observation, have done a good job of notifying parents. That's part of their responsibility, and they take that seriously. How they jointly collect that information, that's not something that that's not something the state is involved in. I assume I'm accurate there. Yes, I am. I get head shakes, so yes, I am.
All right, let's try to go back to Madeline Anderson at Fox 6. Madeline? Okay, how about Royce at WisPol? Royce at WisPolitics? And finally, McKenna Alexander, WQOW. McKenna. All right, and with that, we will conclude today's briefing. We appreciate everyone participating, and we ask you to continue to monitor the DHS COVID-19 web pages for data and guidance. Additional information can be found on the websites of the Governor, the Department of Workforce Development, the Department of Public Instruction, the Department of Children and Families, and Wisconsin Emergency Management. Be safe and have a great afternoon.
This program is a production of Wisconsin Eye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. Wisconsin Eye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.
With many people saying, I want to have my kids personally in school.